Hello, everybody. So welcome back to another lecture of medical microbiology for medical students. Today, we'll be focusing on gram-positive bacilli. So my name is Brody Duncan. I'm a medical microbiologist here in Hamilton, as well as an assistant professor in the Department of Pathology and Molecular Medicine. And let's get started. So today, our main goals are, first and foremost, to learn the names of some medically important gram-positive bacilli. We're just going to talk very briefly about some of the clinical features, but then really learning the names is the main goal for you guys right now. We'll talk a little bit about the relative virulence of each species, and then we'll also talk about some very basic phenotypic tests and why they can be useful for us in medical microbiology. So here's our overall slide of all of the typical bacteria that will grow in normal cultures. And today we'll just be focusing on this small column on gram-positive bacilli. So you can see there's only three main genera that we are going to care about here. And let's get started. So when we talk about gram-positive bacilli, just as a very brief reminder, gram-positive means purple and bacilli means rods. You got to just really get that in your head there. One funny thing about gram-positive bacilli is that there's a lot of variation in terms of what they can actually look like. So some of them are big and blocky, like these ones on the left, where they almost look like, train cars lined one after the other. In the middle, we have our small and uneven ones. These, can be a little bit curvy, a little bit long, a little bit short, but they're still definitely bacilli. And then on the right, sometimes gram-positive bacilli can be quite small, and some of them, mixed among all of these cells, are actually almost a little bit coccoid. So if you're not being careful, you might, look in the wrong place and not scan enough of it and think, oh, maybe I've got some gram-positive cocci here. But even if you look at the tiny little circular almost ones, you can see that they do still have a little bit of length to them. So these are still gram-positive bacilli, but obviously looking very different from our big and blocky ones here on the left. So if we talk about some specific genera, Bacillus is the one we'll start with. This is our, most of them are our classic big and blocky gram-positive bacilli. It's a bit convenient, I guess, that they're called Bacillus, and then there are these big bacilli, so you can try and remember it that way. We'll start just by talking about the commensal bacillus. So there's a number of different species inside of bacillus that are commensal organisms. They are, not very pathogenic. They have relatively low virulence. A lot of them are actually environmental, so they're associated with soil, associated with plants. Because humans live in the environment, we also do get them on and in our bodies. For example, we sometimes will find them on skin. They can accumulate in the dust in your house and get on your clothes. But on the whole, these are not terribly pathogenic organisms. They're all around us all the time and not generally causing a lot of disease. However, that doesn't mean they can't cause disease, because that's why they have this little faces. Most of the time they're not pathogenic, but especially in a hospital setting, you do still have to be a little bit concerned that they could be causing illness in our patient. I'd say the two most textbook things that you would see is, first of all, in a hospital setting, you can certainly get contamination of PICC lines and other sort of central venous catheters. This is a situation like with a lot of potential contaminating bacteria where they do live normally on our skin, but if they get an opportunity where they're able to stick onto some plastic and hitch a ride inside the human body into some sterile sites, then they can cause disease. This is not very common, but you do see it. Another situation that's a little bit more common is that they do cause food poisoning as well, especially Bacillus cereus. The mechanism for this is you can see in the gram stain that these are not just normal bacilli, but they can also have little spores inside them. You can see those here. And these spores can be like little seeds where if they get into some food, for example, they can sit there. And then as you heat the food up or you leave it outside, you leave it at room temperature sitting on the counter, then they can germinate and then the bacteria can start to grow. And again, bacillus in general are not terribly pathogenic. So if you eat food contaminated with bacillus, you usually don't get septic, you usually don't die from it. But they can produce toxins that can then cause you to have this, short-term aggressive kind of vomiting or diarrheal disease that then passes. But on the whole, commensal bacillus, our species are not that aggressive. Bacillus cereus, again, being the most common one you'll see. I'll contrast that with Bacillus anthracis. So Bacillus anthracis is also, a quote unquote environmental organism. You do find it in the outdoors and soil. You see it associated with animals like goats and horses and zebras and things like that. But Bacillus anthracis is not your friend. She is nasty. And, Bacillus anthracis is not an organism that you would ever normally find in a human host. There is no situation where you would find Bacillus anthracis in a person and think, oh, maybe this is just part of the normal flora. The reason for this is Bacillus anthracis is a very, very virulent organism. We all know that anthrax can cause very severe disease and life-threatening disease, including in perfectly healthy hosts. So this is a bit different from some other genera of bacteria where it's a bit more of a spectrum from not so virulent to middling virulence and then somewhat virulent. For Bacillus, we really have these commensal species that don't cause a whole lot of invasive disease, and then Bacillus anthracis, which is actually one of the most aggressive bacteria on the planet. So there is a bit of a dichotomy there. When we're talking about Bacillus, one useful question is there still a role for phenotypic tests when, now in 2023, when these videos are recorded, we have a lot new fast automated methods we can use to identify bacteria. And these species are a great example where the answer is yes. There are some organisms that are actually so closely related that it's difficult to distinguish them by automated methods. Bacillus anthracis and Bacillus cereus are actually part of the same species complex. So a lot of our fancy $1 million machines can't effectively differentiate them. So here we can still use some old school testing. Very briefly, some examples of this are that if you look at an agar plate, Bacillus anthracis typically does not do hemolysis, while run-of-the-mill Bacillus cereus usually does have a lot of beta hemolysis underneath it. So this is a picture of anthrax because you've got the colonies and hemolysis. Similarly, if you were to inoculate these organisms into semi-solid agar, Bacillus anthracis is not motile, it doesn't swim around, so it usually just stays in one place, while Bacillus cereus does have motility, and you could see it swimming around a little bit in this agar. So this is an example of something where, you really have to pick the right tool for the right organism. And Bacillus anthracis is an example where we really have to still do our old school historical testing that, they could have done 100 years ago because it's effective and it's useful. Now I'm going to talk about Crinibacterium. So Crinibacterium are also very common gram-positive bacilli. Most of them are commensal, similar to Bacillus. In the top right, you can see the gram stain for Crinibacterium is these kind of smaller, a little bit more regular gram-positive bacilli. This is often called coriniform or diphtheroid shapes. Crini are another organism where it's like, maybe they could be pathogenic, but most of the time they end up just being contaminants. They live on totally healthy, normal human skin. This is where the name for them comes from. Usually in the hospital setting and the outpatient setting, you'll see them as a blood culture contaminant, where again, just a little bit of skin bacteria gets on the needle and the blood as it's on its way into the tube, as opposed to actually causing disease inside the person. But if it gets where it's not supposed to in a sterile site, they certainly can cause disease. They're low virulence organisms, but they're not zero virulence. So an example of this would be, it's normal bacteria on top of your skin, but if it gets under your skin and gets stuck to a prosthetic, for example, a joint replacement, then it can just slowly over the course of weeks and months and sometimes even years cause a little bit of damage because of its low virulence, and then you can get failure of the replaced joint. So this is an example of, again, an organism where it is usually not very pathogenic, but you can't ignore it entirely. It also has a cousin, Crinibacterium diphtheriae, who is nasty, nasty, nasty. And again, more nasty in the sense that if we find diphtheria in a person, we will, the vast majority of the time, treat it as a true infection that has to get treated. It is almost never a contaminant. Here I just have some pictures. Historically, diphtheria often causes these head and neck infections that are life-threatening and do kill people. Obviously, we have vaccinations and antibiotics now, so this isn't as common in a place like Canada, but you still have to keep it on your radar. Finally, listeria is the trio of medically important gram-positive bacilli that you'll typically find in blood cultures and things like that. You can see the gram stain is, again, these smaller sort of gram-positive bacilli. Some of them are almost coccoid. Listeria monocytogenes is really the only important species for you to know at the medical student level. It is not friendly. It can cause foodborne illness, such as diarrheal disease. But the most important thing is that in very vulnerable patients, especially the very young, like newborns, and older patients, immunocompromised patients, it does cause invasive disease, such as meningitis. And historically, this has been a very important cause of meningitis and death in newborns, although nowadays, with the use of antibiotics and effective other medical diagnostic techniques, this is not so common. But Listeria monocytogenes is definitely an organism that you need to be aware of, because if you miss it, your patient could become very sick and die. So those are the main species. I just have a little grab bag of bonus species that you may hear of and that we might talk about in some future lectures, just for you to be aware of. Nocardia are not very friendly. They are environmental organisms, but they can also cause invasive disease. One thing that's notable about them is that these are gram-positive bacilli that form these filaments, and they also can be modified acid-fast. So we'll talk about these in a later lecture. Lactobacillus is a species that you may have heard about because it's commonly used as a probiotic. You find it in yogurt, you find it in fermented foods. Otherwise, you can actually take pills with lactobacillus. This is an organism that gets a little face because most of the time it's a contaminant. But again, if it gets where it's not supposed to, somewhere deep inside the body, it can cause disease. And finally, erysipelathrix bruciopathiae, which is a bit of a mouthful, is an uncommon organism. It's mostly a trivia organism, I think, at the medical student level. But this is an organism that can cause disease such as cellulitis or endocarditis. But you mainly get it from animals, like pigs. So unless your patient has had close contact with animals or animal meats, this is not something that you're going to be seeing, really. So those are the gram-positive bacilli. This was a short lecture, but these organisms do show up in blood cultures and other clinical situations. So I think it's important you're aware of them. Just to summarize, we have bacillus, where it's mostly commensal bacillus species, but there is this incredibly nasty person, Bacillus anthracis. We have crinibacterium, which are mostly commensal organisms, do not cause a lot of disease, but then Crinibacterium diphtheriae is historically very important. And finally, Listeria monocytogenes, which has quite a bit of virulence, even though we don't see it that much. So these are the references for the pictures I used in this presentation. I hope you all learned a lot about gram-positive bacilli, and we'll see you next time.